Hello, my name is Dr. Chloe Russo, and I am the second-year Allergy and Immunology Fellow at Emory University. And in today's talk, I want to review the 10 warning signs of primary immunodeficiency in the pediatric population. So let's start off with what is the immune system. I like to think of the immune system as the defense, and bacteria, viruses, fungi, and parasites as the offense. The immune system is not just one organ, but a multitude of organs all aimed at protecting the body from infections. The thymus is an organ located in the upper chest, and it's where immature lymphocytes are educated to become mature T lymphocytes. The liver is the major organ responsible for synthesizing proteins of the complement system. It also contains large numbers of phagocytic cells, which ingest bacteria in the blood as it passes through the liver. The bone marrow is the location where all cells of the immune system begin their development from primitive stem cells. Tonsils are collections of lymphocytes in the throat. And lymph nodes are a collection of B and T lymphocytes throughout the body. Lymph nodes are one of the major sites of antibody formation. The spleen is a collection of T lymphocytes, B lymphocytes, and monocytes located midstream in the blood. And finally, blood is the circulatory system that carries cells and proteins of the immune system from one part of the body to another. So what are primary immune deficiencies? They are a group of over 150 heterogeneous but rare disorders, antibody defects being the most common, and most are due to a single gene defect. What is the hallmark of primary immune deficiencies? Always increased susceptibility to infection. One of the chief complaints I get in immunology clinic is, but my child is constantly sick. There must be something wrong with his immune system. He's not like other kids. Things to remember though, the average immunocompetent child gets 6 to 8 URIs per year and up to 10 to 12 if they're in daycare. Frequent URIs are normal in school-age children. And just like the rest of the body needs to develop, so does the immune system. Things that are risk factors for frequent infection include having daycare or school-age siblings, secondhand smoke in the house, any anatomic abnormalities, retained foreign body, and reflux. Now knowing what lies in the range of normal, when should you worry about primary immunodeficiency in your patient? Here are 10 warning signs of primary immunodeficiencies. 4 or more new ear infections within 1 year. 2 or more serious episodes of sinusitis within 1 year. 2 or more months on antibiotics with little to no effect. 2 or more pneumonias in 1 year. And you always want to think about primary immunodeficiency in patients with failure to thrive or who aren't growing normally. Recurrent episodes of either deep skin or organ abscesses. Persistent oral thrush, often in patients older than 1 year old, or persistent fungal infection on the skin. A patient who often needs to be admitted for IV antibiotics to clear infections. 2 or more deep-seated infections, including septicemia, or infections with opportunistic or unlikely bugs. A family history of primary immunodeficiency should make you worried about primary immunodeficiency in your patient. I also often ask if there's any family history of recurrent infections, sudden infant death, or death of unknown cause in young children. I hope these 10 warning signs were helpful in discerning whether a patient you're seeing in the hospital, in clinic, in Gen Peds, or in a subspecialty might have a primary immunodeficiency. Check out info4pi.org for more information for both clinicians and patients. Thank you and have a great day.
Created using Powtoon.